All right. Well, thank you everyone for joining us. We're going to get started now. Thank you for being here so we can talk to you and introduce the $55 million CalGrows Innovation Fund. My name is Renita Polk. I work with the California Department of Aging in the Office of Direct Care Workforce. So we have quite a bit to get through today, so let's get started. So today, this is the agenda that we'll be working with today. We are going to start just with an introduction to the Department of Aging and to our partner that we've been working with on this project, CalEd. Then we will have some kind of general information, housekeeping for today's webinar. Then I will walk through the background and the purpose of the Innovation Fund, and then we'll get into more details about the specific application components and guidelines. I will then walk through the timeline. And after my presentation, we will have time for questions. So how the question period is going to work is, as I'm walking through my presentation, if anyone has a question, we're going to ask you to put it into the Q&A box. And then when the time comes for questions, I will go through the questions that have been submitted in the Q&A box, and I will repeat each question out loud, and then I will answer each question. We do want to note that we did have a previous webinar on Tuesday, and we've already received some questions via our website. So if there is a question that we've already answered and the answer is on our website, then we will not answer those aloud. We want to get to as many kind of unique questions as we can. But if you have a question that's not answered today, we will be compiling all the questions that we receive, and we will be providing written answers that will be posted on our website. So I will repeat most of that again when we get to the questions segment, but just wanted to say that up front as well. So let's start with an introduction. The California Department of Aging is under the umbrella of the California Health and Human Services Agency. It administers programs that serve older adults, people with disabilities, family and friend caregivers, residents in long-term care facilities. And these programs are funded through the Federal Older Americans Act, the Older Californians Act, through the State General Fund, and through the Medi-Cal program. I'd also like to introduce Angela Parikh with CalEd. We're working with CalEd on this project. So Angela, please go ahead if you'd like to introduce yourself.
Hi, thanks, Renita. So excited to be here on behalf of CalEd and to see such a huge participant turnout today. So CalEd's going to be partnering with CDA. We're going to be providing the backbone services and administering the Innovation Fund, and also providing program support for the CalGrows program implementation. So excited to be a part of this. Thanks, Renita.
Thanks, Angela, and we're happy to have CalEd working with us on this. And so when we also get to the question and answer section, if there are more technical questions, for example, about the how to use the online application portal, or more kind of technical questions, Angela will be here to answer those types of questions, and I will be handling the more content questions about the fund. And a few other things before we get into the meat of our discussion today. Closed captioning is available for this webinar. You should see on the bottom of your Zoom navigation bar, there's a button that says CC Live Transcript. So you can click on that for closed captioning and to enable transcription. The video recording for today's webinar, including the slides, as well as written answers to all of the questions that have been submitted will be available on our website, calgrows.org, early next week. And then finally, so any final answers to any questions, they will be available in the CalGrows RFA document. So if you have a question, I encourage you all to thoroughly look through that RFA document because the answer may be in that document. However, if it's not, there's also an additional document on our website that we have been updating fairly regularly with answers to questions that we receive. And that is also available on the calgrows.org website. All right, so now let's talk about the Innovation Fund. The CalGrows Innovation Fund is targeting direct care workers and unpaid family and friend caregivers. There are a couple of kind of stats and facts and figures on this slide about the direct care workforce. We know the direct care jobs are central to the economy. They're one of the largest and fastest growing occupations in the state. And direct care is essential to aging adults and those with disabilities in maintaining their health and well-being while at home. And we've particularly seen that with the COVID-19 pandemic. Direct care workers have been on the front lines providing care for adults that are trying to stay home and stay safe from COVID-19. But that has also placed some burden and stress, additional burden and stress on direct care workers. And so we know a couple of things about the direct care workforce that are on this slide. 80% are women, a little less than half are immigrants, and a little more than half receive some type of public assistance. So that tells us a few things, that this workforce is largely underpaid, and that they come from communities that have historically been underserved and underrepresented. And so with this program, we want to provide skills and improve skills and provide training to this workforce to improve the quality of care and help address some of these challenges that direct care workers encounter. So I do want to take a minute to also talk about unpaid family and friend caregivers. So 2/3 of older adults receive care from unpaid family and friends. And so these unpaid caregivers are most likely, a lot of them, in addition to caring for their family member or friend, they also could have a full-time job that they're trying to juggle with caring for their family, and perhaps also have responsibilities for taking care of children. So we also need to think about those unpaid family and friend caregivers and the support and the care that they're providing for the older adult population. So with this program, not only are we focusing on providing training for paid direct care workers, but we also want to provide training for unpaid family and friend caregivers with this program. So the Master Plan for Aging, this is a statewide initiative that began a few years ago. And the Department of Aging is spearheading the Master Plan for Aging. And so there are 5 goals associated with that master plan that are listed on this slide. But our program, CalGrows, falls into goal number 4, caregiving that works. And so again, the goal of this program is to improve the skills of caregivers, to in turn improve quality of care for older adults and care recipients. So let's talk about the Innovation Fund now. So the Innovation Fund, it is a total of $55.6 million. And that funding, it will be one-time funding. So unfortunately, at this point, this will be a one-time grant. There won't be additional funding in later years, at least at this point in time. We're hopeful that perhaps additional funding can happen in later years, but that is not part of the plan currently. So the funds must be used for training and incentive programs focused on direct care workers, or focused on unpaid family and friend caregivers. And so with this, we want to fund programs, training programs that address some of the common themes and challenges that are experienced by caregivers. And the Department of Aging, earlier this year, did some work with Collaborative Consulting, which is a consulting firm. And so we worked with them to do some research and also some stakeholder engagement to ask direct care workers, what do you want to see? What are some types of training programs that you would be interested in? What do you want to learn about? And also asking them about the challenges that they've experienced in their work, challenges in terms of accessing training, what are the issues there? And there are a couple of common themes and challenges that came out of that work. Just a few examples. A lot of the workers that responded to the survey said that they often didn't have time for training. They couldn't take the training during their work hours. So then they had to find time during their off hours when they're not working to take the training. And so then there was a challenge of getting to the training, finding transportation, or perhaps finding childcare during the time that they're in the training. Some workers mentioned that their past training opportunities haven't met their expectations for quality and effectiveness. So once they go to the training, it's not really relevant for their job. And a lot of workers mentioned that they would like to learn skills about how to work with specialized populations, for example, how to work with individuals with dementia. So those are some of the things that came out of that work that we'd like the applicants for this funding to think about and target with their applications. You can find the results of that work and more detail about that work on our website, calgrows.org. So if you're interested in if you want to, if that will help you think about how to shape your application, you can find that information on our website. So let's talk about eligibility requirements now. Who is eligible to apply? So we've been getting a lot of questions about who is eligible. You know, is my organization eligible to apply? Are they not eligible to apply? So we've listed here, I want to emphasize that these are examples. The different types of organizations listed here are examples. This is not an exhaustive list. So if your organization type is not on this list, they may still be eligible to apply. If they're not on this list, it does not mean that you cannot apply. I think what's most important about whether your organization is eligible to apply or not is whether it meets the different requirements that I'm going to go through in that blue box and also on the next slide. So to be able to apply for the program and be eligible, organizations have to have a presence in California within the last 3 years. And a single organization can apply, or a group of organizations can come together and apply with a joint application. And the organization must be in good standing and qualified to conduct business in California as verified by the Secretary of State. So these are a few other requirements relating to experience that we would like the applicants to have. Must have some experience working with older adults, individuals with disabilities or caregivers, have some experience managing or training the target direct care workforce, have experience outreaching to and engaging the target direct care workforce, expertise on issues impacting older adults, people with disabilities and caregivers, and a commitment to diversity, equity, and inclusion. And so if your organization, maybe you have experience working with older adults, but you don't have experience managing or training the direct care workforce, this is an instance where you could team up with another organization that may have that experience that you don't, and develop a joint application, and you could apply together. So I think what's most important when you're trying to think about, is my organization eligible or not, is that you meet these eligibility requirements here, and also the ones that were mentioned on the previous slide. So having a presence in California in the past 3 years, and being in good standing to conduct business in California. And so let's talk a bit more about what we mean by equity in access. So we know that the older adult population in California is getting larger. Over the next few years, it will be the largest that it's ever been in history. But not only is the older adult population getting larger, it's also becoming more ethnically diverse. Ethnically and racially diverse. And so we want to support the development of a culturally diverse workforce that is able to provide culturally appropriate care to serve the diversity of the older adult population. And so as you're thinking about your applications and what types of training you want to focus on in your application, please also, we want applicants to think about building up this culturally diverse workforce, providing training to help workers provide culturally appropriate care. So we want applicants to think about that in their application, and that has to be a component of your application. And then also addressing barriers to access for training for the direct care workforce. I mentioned in a couple of slides ago, we did some work looking, surveying direct care workers, and one of the things that they mentioned was having difficulty accessing training. So we want applicants to also think about how to address barriers to access for training for direct care workers in their application. We also like applicants to address specific core competencies in their applications. So listed here are some of the core competencies that we'd like applicants to address. There are 4 different categories: physical aspects, emotional aspects of the job, complexity of the population, and workplace readiness and professional growth. And these core competencies came out of the work that was done by Collaborative Consulting, and a lot of the great research that they did to help us design the program. So the applicant should base their training curriculum on the needed and desired competencies of the target workforce. And so in your application, you will be required to identify which one of the core competencies on this slide that your training will target. You have to address one, however, you're not limited to one. So if an organization wants to address multiple competencies listed on this slide, then you are able to do that. And let's talk a bit about some of the other components of the proposals and applications. Incentives. So at the beginning of this presentation, when I talked about the program, I mentioned it was a training and incentive program. So that's what we are going to provide with this program. That was kind of the original idea before this program even was got off the ground. It was developed as a training and incentive program. So every application must provide some type of incentive for the paid direct care workforce. I do want to point out that unpaid family and friend caregivers will not be eligible for incentives, but they can still take training courses. So an example of some incentives that would be eligible, paying workers for the time that they spend in training, offering gift cards for workers to take trainings, providing stipends for a retention for a specified duration of employment after taking the training. We are not specifying what the specific incentives should be. We're leaving it up to the applicant. They can decide what they want the incentive to be, but there must be some type of incentive with your proposal. Also, training accessibility. So think about making your training accessible, offering it on different days and different times that accommodate the schedules of the workers, providing multilingual trainings and materials so that workers can take the training in their preferred language. Perhaps providing some type of transportation support or childcare support, or providing technology support for workers. The training design. So we'd like applicants to also think about the design of their training and making it work for the direct care workers. For example, offering maybe offering hybrid trainings, a mixture of in-person and virtual trainings, and also thinking about customizable trainings that can be customized based on the skill levels or the needs and interests of direct care workers. Outreach. So we're also asking applicants to describe their outreach strategy in the application. And we want to make sure that outreach is culturally responsive to ensure that communication about your initiative is linguistically and culturally appropriate. Are you utilizing existing workforce networks so that you can outreach to your target workforce? Are you utilizing social media to get the word out and to reach the target workforce? So those are a few things that we want applicants to detail and provide in their application for the program. There are two funding categories that organizations can apply for. There's proof of concept. So these are smaller awards that would support pilots that are ready to be field tested. So you may have an idea for a training curriculum or may have an idea for how to train workers, but you've never actually done it. And so you just want to apply for funding so that you can do that pilot. So that would be proof of concept. Ready to scale, these are larger projects, and they would be to expand approaches that maybe have already been piloted. For example, if you have a training program that has shown results at one specific site, and it's shown to work well at that site, so you want to expand it to other sites, that would be an example of a ready to scale project. And I do want to point out for for ready to scale projects, here it says more than $1 million. However, we will accept applications in the ready to scale category that are less than 1 million. However, the proof of concept applications are capped at 1 million. So there are a few other pieces of information that we're asking for in this application. All applicants need to include some basic information about your organization, a profile of your organization. You have to describe which of the two funding categories you are applying for, provide an overview of your project, answer the questions in the application. And if you look in the RFA document that's available on our website, the application questions are listed there. That also includes a training course template, a project budget, including a budget narrative, and additional documentation relating to previous or other awards that you perhaps received from other state agencies or departments, and then a certification that all of the information in the application is accurate. I'll talk a bit more about the budget now. The budget, a maximum of 10% of the budget can be used for indirect costs. And no more than 50% of the budget should be used for outside contractors or consultants. Funding cannot be provided for a formal program evaluation. The reason for that is that the Department of Aging is working with UCSF or UC San Francisco on an evaluation of each of the funded projects. So CDA will be conducting its own evaluation of each project. The budget must outline the specific project personnel. So these are staff members that are going to be involved in this project. And then a budget narrative will also be required. We're asking for no more than 2 letters of support. And these are letters from other organizations that your organization has worked with, and they can testify to your work. Contact information for references, a maximum of 3. Prior year financial statements. If you have audited financial statements, that would be preferred, but it's not required. An operating budget for the current year, and documentation of other related awards that have been received. And for other awards that have been received, perhaps from other state agencies or departments, we are not asking for the full kind of contract. We just want some documentation that you've received this award. So it could just be a copy of the award letter, or perhaps a copy of the press release showing that you received this award. All grant applications must be submitted through the online portal at calgrows.org. If for any reason you're having trouble with the online portal and you can't submit through the online portal, please contact us at innovationfund@calgrows.org, and we will figure out a way for you to submit your application. Applicants are encouraged to apply early, but all applications must be received no later than 11:59 p.m. Pacific time on December 2nd, 2022. So we'll walk through the timeline of the project now. And this is my last 2 slides before we get to the questions. So the RFA was released on November 7th, 2022. And you'll notice here it says that the last day to submit questions for the webinars was November 14th. However, we did extend that a bit. So as long as you have submitted have submitted questions by today, we will work to get written answers to your questions, and those will be posted on our website early next week. So we did extend that a bit, knowing that we had another webinar today, so we may be receiving additional questions after the 14th. At a previous webinar on the 15th, and then today's webinar, we will be posting answers to the questions on November 21st. The final day to submit your application is December 2nd, 2022 by 11:59 p.m. And the application review and evaluation process will occur during the months of December and January, from December 5th to January 31st. Notice of awards will happen by January 31st, depending on how the timing works out with the evaluation of applications. That may happen before January 31st, but no later than January 31st. The start date of agreements will be no later than March 1st, 2023. Again, depending on how the contracting process works, some agreements could start before March 1st. It just depends on how that process goes, but no later than March 1st. Agreements will end December 31st, 2023. So all projects and all funds have to be expended by December 31st. And final project reports are due on January 15th, 2024. So that is the end of my presentation. And so we can get into the questions now. I'll just repeat a little bit of what I said at the beginning, that if you have a question, please put it into the Q&A box. We may not be able to get to every single question in the Q&A. However, if we do not address a question that you have put into the Q&A box, we will be providing written answers to all of the questions that we receive on our website early next week. And so we will kind of be curating the questions a little bit. And so we'll prioritize unique questions that have not been answered before and that we have not posted answers on our website about. So with that, I will get started and start going through the questions that are in the Q&A. So we have a question, which funding type is most appropriate if we are primarily piloting a new career track, but also expanding to existing career tracks? So I mentioned the funding categories, so either ready to scale or, oh my goodness, I'm sorry, the other funding category is escaping me right now. Proof of concept or ready to scale. So you will have to pick between either proof of concept or ready to scale. So a pilot would fall into the proof of concept. However, if you're expanding something that already exists, then that would fall into the ready to scale category. So the next question, and this, I'm going to read it out loud, but this may be a more technical question for Angela, but I will read it first. Within the application process, are we able to provide any flyers and processes to back up what we are putting forward in our application? There is a limited word count. Do embedded links work, or can we add attachments? And I think I'm going to perhaps pass this to Angela, because I think this is more of a technical question about the abilities of the application portal.
Hi, yes. So as far as that piece, as far as embedding a link into the text box, I don't believe that is possible. But what we can do is if you reach out to us individually, you can contact us at innovationfund@calgrows.org. If you're running into problems with embedding those links. The sections where you're able to upload information for templates is through the training and the budget. So if that's something that you're needing to do or wanting to do, you could just reach out to us at innovationfund@calgrows.org.
Thanks, Angela. I will move on to the next question. If the courses trainings are to be offered for free, can they be incorporated into an existing 4-credit program and offered as a credit-free bonus course? Thank you for the question. I think if the applicant is working within or with another organization, say an educational institution that is offering a program for credit, and they would like to kind of work with that educational institution and offer their training as a part of that course, I think that is would be allowable, just that the educational institution that you are working with would need to be included as a partner in your application. We have a question about the core competencies. So do the core competencies selected all have to fall under one category? No, they do not. So there are 4 categories, but you can pick and choose between those 4 categories. So you could, if you wanted, pick from the physical aspects of the job category and then have another training course that's more focused on readiness and professional growth. So you can kind of mix and match within those categories, and you are not restricted to just one category. Next question, what is an ideal timeline for proof of concept? Can you give an example of doing an online training? So I can't give, I guess, an example of a timeline. However, we do want applicants to be cognizant of the fact that this program is ending on December 31st, 2023. So that's when the funding will end. So there's a little less than a year for the full life of the program. So please be cognizant of that and be realistic about what you can do during that time. For the proof of concept, I think there, of course, there will probably be some time in kind of planning and just getting things off the ground, but there does have to be a training that is offered and piloted within the time frame of the program. So by December 31st, 2023, your program has to wrap up by that point. All right, our next question. For this application question, we just wanted to confirm that it is not a requirement. If there are related awards to this RFP, an award letter or grant agreement would be sufficient, correct? Related awards provide documentation and status of other related awards received if applicable. So yes, it is not a requirement that you have received other awards relating to the project. If you, in the case that you have received awards relating to the project, then we would like to know about it, but that is not a requirement for this program. There is a question here. Would job coaches in an employment services organization qualify as direct care workers? So for it to be eligible for this program, the direct care workers would have to be providing care for either older adults or individuals with disabilities. I don't believe job coaches would qualify. And so the direct care workers would have to be providing care for individuals that are eligible for Medi-Cal or are on Medi-Cal to be a part of this program. I do want to emphasize that not all of the care recipients that they care for have to be on Medi-Cal, but they do have to at least work with a few recipients of care that are on Medi-Cal. I will say, as I'm going through the Q&A, I am seeing some repeat questions. So if there is a repeat question, I might just say, we've already answered that earlier, just so you know. So that we have another question asking about if the courses, the trainings are offered for free and if they can be incorporated into an existing 4-credit program and offered as a credit-free bonus course. So we did answer a similar question to that earlier. Okay, are there, the next question, are there any funds being made available to augment cost of travel for paid caregivers? Augmenting cost of travel, that would be considered as an incentive. So an organization, if that was the incentive that they wanted to offer, paid caregivers to take the training. So providing funds to pay for travel to the training, that would be an incentive that would be allowable as part of your application, but it is up to the organization to decide what that incentive will be. So we are not requiring specific types of incentives, just that there is an incentive. The next question, my organization, Able Community Development Foundation, works with the Asian senior population in Contra Costa and Sacramento counties. We are seeking to partner with other organizations who serve the senior population in the counties where we are currently working. Please help share our interests with the organizations that plan to apply for this grant. Well, unfortunately, we can't, connect different organizations that may want to work to team up and submit a joint application. So we can't kind of provide those types of connections. But please, if there are others on this call that hear this, and just know that there are other folks interested in pairing up on applications. So hopefully that was useful. Excuse me. Next question. I acquired an in-home care agency recently, but the agency has been servicing since the last 10 years. Am I eligible to apply? Part of the eligibility requirements is that an organization has a presence in California within the last 3 years. So as long as your organization has had some presence in California within the past 3 years, they would meet that eligibility requirement. Next question, are tribes and tribal organizations eligible to apply? Tribes and tribal organizations, as long as they meet those eligibility requirements that I mentioned earlier, for example, having worked with older adults and having experience managing, training the workforce, those requirements that I mentioned earlier, then they would be eligible to apply for this grant. So is there a reason there is such a quick application deadline? Do you already have organizations or programs in mind? Yes, we realize that this is a very tight deadline, a very tight window. But we are trying to kind of get applications and things as soon as we can, so that we can get the program started as soon as possible, with knowing that there is a deadline of December 2023 to use these funds. And that is not a deadline that the Department of Aging necessarily has control over. That's a bigger discussion that happens because these are federal funds for this program from the American Rescue Plan Act. So there are specific kind of deadlines and rules that come with that. So yes, we understand that this is a tight deadline, a tight window, but we're trying to move things as quickly as we can so that the programs have as long as they can to run, and knowing that they must end by December of 2023. And no, we do not have other organizations or programs in mind. We are going to review all of the applications the same way. The scoring rubric is available in the RFA document on our website. And so all of the applications will be reviewed the same way using the same scoring rubric. Please expand on a commitment to equity, diversity, and inclusion is our next comment. Yes, thank you for that comment. So I described how the older adult population is becoming more racially and ethnically diverse. And so there's a need for culturally appropriate care. Actually, I just read this article this morning. It was focused on an Indian family. I believe it was in Santa Clara County, I believe. But one of the points that was made in the article was that the families often didn't want to put their older loved ones into kind of assisted living or some home like that. But one of the reasons that was given by a family in the article was that the care that was offered there, for example, the food wasn't what their family members were used to eating. There are kind of more Western biases for the types of food that were offered. And they were like, well, my family member is not going to eat that. So that is one of the things that kind of came to mind when I read this comment. So those are the types of things that we want to train our workers about. And so making sure that you are thinking about all those different types of things, even when it comes to like the type of food that the individuals that you're caring for are eating. What kind of food do they want? What are they used to eating? And how can you help provide and prepare those types of foods? So that is just a small example. I hope that's helpful on kind of what we mean when we say commitment to equity, diversity, and inclusion. The next question, when addressing core competencies, does one have to cover all bulleted areas under that competency? No, you do not. And thank you for that question. I will clarify. In the 4 categories, there are several bullets in each of those categories. And so we're asking organizations to pick just one of those bullets to focus on in their application. And again, they can pick more than one, and the ones that they pick don't have to be in the same category. But we are asking to pick at least one of those bullets within that larger category. Understanding you don't want to define incentives, can you speak to types of incentives that are not allowable? Thinking about this, I don't think that there would necessarily be any types of incentives that are not allowable. At least I can't think of any off of the top of my head, but just some examples that could be that hopefully this is helpful to you, offering gift cards for those workers that participate in the training, providing transportation vouchers or bus vouchers to workers so they have a way to get to wherever the training is being offered. Providing wage replacements, so paying workers their normal hourly wage for the time that they spend in the training course. So those are a few examples. Hopefully that was helpful. And we'll move on to the next question. Within the RFA, do the target programs settings allow for home care aides and personal care assistants? If yes, how so? Yes, so for the types of workers that would be eligible, so for example, personal care assistants would be eligible to participate in these trainings. Ultimately, kind of the broader definition of direct care worker for this program would be someone that provides direct services, either in an individual's home or in a community-based setting, and that individual, not that specific individual, but at least some of the folks that they care for would need to be Medi-Cal, on Medi-Cal. So that we have kind of a very broad definition of direct care worker for this program. And the reason for that is that we want to try and reach as many folks as possible that have that direct interaction and provide that direct care for older adults. And I think what might be helpful if you're wondering about, what types of workers are eligible, we have a link on our website to a webinar that we did earlier this year that provides a little more kind of background information. We didn't have time to get into a lot of that today because I wanted to go through the application components, but I'd encourage you to look at the slides for that webinar that we had earlier this year in September. And so that would, I think, provide a little more background on the type of workers that would be eligible for this. All right, our next question. If training has been delivered to one or more health systems, but just began, in parentheses, under 100 workers have completed. So there is not robust data available on retention just yet. Is this considered proof of concept or ready to scale? I think since you had a project that has already been piloted, and you're wanting to expand it to another health system, I would think that that would be ready to scale because it's already been piloted. At least that's what I'm gathering from this question, that you've already piloted the program. And so examples, ready to scale, something that's already been done and you want to expand it into a new site or a new location or a new population. And proof of concept would be something, you have an idea for this, but you haven't actually implemented and carried it out yet. Next question. Can you explain in more detail, is there a process we have to complete with SOS, Secretary of State? And that's in reference to the requirement that applicants must be in good standing and qualified to conduct business in California, as verified by the Secretary of State's website. So for this question, we likely will have to provide a more in-depth written answer that will be on our website, but there is a process on the a form on the Secretary of State's website where you can go to it and you can put in information for your organization and verify that your organization is qualified to conduct business in California. But we will likely have to write up a more in-depth response to that question, which we will provide on our website. Concerning the budget, if 50% of the budget can be used for outside contractors or consultants, can that include vendors we work with to carry out incentive programs? Yes, I believe so. An outside vendor that you're working with to carry out an incentive program, they would be considered an subcontractor or an outside contractor or consultant in the sense of the budget. All right. Next question. And I'll see, we're getting close to our time, so I'll go through a few more questions, but just want to remind folks, if we do not get to your question, we will be providing written answers to questions on our website early next week. All right, so our next question, could this be used to create something such as an activity coordinator course so that workers can advance, given that DHCS approves those providers normally? So yes, activity coordinators would be eligible to participate in this program, would be a target worker that could be eligible for this program. All right, next question. Can we use and collaborate with the local LA County senior centers that is a government program funded by the Department of Aging and Disabilities. This would be a part of the outreach and marketing strategy since they service the communities we are targeting. Yes, if you would like to coordinate and collaborate with local government, local governments are eligible to apply and be a part either as a sole applicant or as part of a group or consortium and submit a joint application that is eligible. But I do want to emphasize that the proposal and the application that is put forward, it must provide training and incentives. So from that question, I'm not sure, it sounds like maybe you're thinking your proposal will just be outreach and marketing. So I do want to emphasize that your proposal has to also offer training, and whether that is collaborating with another training or collaborating with a training organization. So another organization will provide the training and your organization may provide the outreach and marketing. That would be fine, but I do just want to make sure it's clear that each application must provide training. Next question, is there a limit as to how much money can be spent on incentives per person? There is not a limit on how much incentives can be sent per person, or can be spent per person. But I do just, and if your application is approved, we will kind of go through all of this in the contracting process, but there are certain kind of IRS requirements and information that needs to be collected with a certain dollar amount that is used as an incentive, but that's kind of a later discussion for that will happen in the contracting process if a specific application that offers a specific dollar amount for incentives is awarded. All right, and so this is going to be our last question. Can you further explain what is meant by training template as noted on one of the slides? Are we to provide a full curriculum and training program as part of the application? So if you go through the online portal, there is an Excel spreadsheet that is part of that process of submitting the online application that is a training template, and it will ask some basic questions about the training program that you're offering, and you'll have to identify the core competencies. Actually, now that I'm glad that you asked that question, because I think one thing that we can also do is put a copy of the training template on the website so folks can look at it and understand what is being asked of them before they submit their application. So I see that it is 2 o'clock now, so we are, unfortunately, our time is up. But thank you all for being here. Thank you all for joining us. If you have additional questions, or if your question was not answered during this webinar today, do not worry. We are collecting all of the questions that were submitted through the Q&A, and we will be providing written answers to those questions on our website. So thank you all again for joining us, and we're very excited to see your applications and start learning about all the great ideas that you have. And Angela, do you have any final comments?
I don't. I just want to thank everybody for joining us today.
All right. Well, thank you all again. Have a great rest of your Friday.